The human heart on average beats 100,000 times a day, but as we age, so does our cardiac system, and the heart can begin to beat erratically. The condition is called atrial fibrillation, or A-Fib. Joining me now to talk about the causes and treatment of A-Fib is Dr. Stephen Hamilton. He is an electrophysiologist with the Hospitals of Providence. Dr. Hamilton, thanks for coming on today. How common is A-Fib, and what symptoms do people feel?
So atrial fibrillation is one of the most common heart arrhythmia. Well, it is the most common heart arrhythmia in people. And it's somewhere around 10 to 15% of seniors will have atrial fibrillation. As far as what people feel, it can be very different. Everyone has different symptoms, but very fast heart rates. Sometimes people describe the symptoms like anxiety, shortness of breath, feeling dizzy. All of those things are pretty common for folks to experience with atrial fibrillation.
So what causes A-Fib?
What I usually tell people is bad luck. There are a number of things that you can do that sort of minimize your risk for it, but for electrical problems of the heart, diet, exercise, and healthy habits, they're all good things, but they don't tend to have as much of an impact for electrical problems like atrial fibrillation as they do for other heart problems. One of the few things that people are able to control that help reduce A-Fib is sleep apnea. Another is weight loss. Diet and exercise are always healthy for medical reasons, but that's as far as it goes pretty much.
Okay. Now, how is A-Fib treated?
So there's really two different groups of treatments that we have for atrial fibrillation. One is medications that alter the way the heart conducts electrical signals to try and organize atrial fibrillation to a normal rhythm. And then the other is a procedure to target the problem areas that cause atrial fibrillation.
Do they look at doing drugs first and then surgery? Is that normally how it goes?
Sometimes, but not always. The medicines that we use to treat atrial fibrillation are not as friendly as medicines for other conditions. So it's very common that people have side effects or for whatever reason be unable to tolerate medicines. The procedures that we have can usually allow us to use lower dosages or kind of friendlier medicines to treat the arrhythmia. It varies person to person.
Dr. Stephen Hamilton with the Hospitals of Providence, thank you very much for your time this afternoon.
Thank you.